Maybe you're struggling with some things going on recently or are finding yourself having a difficult time clearing your head. You might find yourself thinking about how to regain your footing and better nurture yourself. Seeking out therapy might just be the way to get back on track. If you're thinking about getting started with therapy, you might have some questions, and I wanted to spend some time answering some general questions that I frequently hear. That way, you can more readily get started on your path towards celebrating you in your beautiful life. 1. How can therapy help me? A number of benefits are available from participating in therapy. Therapists can provide support, problem-solving skills, and enhanced coping strategies for issues like depression, anxiety, relationship troubles, unresolved childhood issues, grief, stress management, body image issues, and creative or performance blocks also. Many people also find that counselors can be a wonderful asset to managing personal growth, interpersonal relationships, family concerns, marriage issues, and just the hassles of daily life in our fast-paced world. Therapists can provide a fresh perspective on a difficult problem or point you in the direction of a solution that you come up with. The benefits we obtain from therapy depend on how well we make use of the process and put into practice what we learn. That's part of why it's really important to have that comfortable and safe fit with your therapist. Some of the benefits available from therapy include attaining a better understanding of yourself, your goals, and your values, developing skills for improving your relationships, finding resolution to the issues or concerns that led you to seek therapy, managing anger, grief, depression, and other emotional pressures, improving communications and listening skills, changing old behavior patterns and developing new ones, discovering new ways to solve problems in your family or your marriage, improving your self-esteem and boosting self-confidence. Number 2, this is the next most frequent question I have. Do I really need therapy? I can usually handle my problems. Everyone goes through challenging situations in life, and while you may have successfully navigated through other difficulties you've faced, there's nothing wrong with seeking out extra support when it could be helpful for us. In fact, therapy tends to work best for people who have enough self-awareness to realize they need a helping hand or a fresh perspective, and that's something to be admired, and I often commend clients for that. We're taking responsibility by accepting that where we're at in life is where it's at for us right now, and making a commitment to change the situation by seeking therapy. Therapy provides long-lasting benefits and support, giving us the tools we need to avoid triggers, redirecting damaging patterns, and overcoming whatever challenges we might face. It's often been said that therapy is about alternatives to navigating things in our lives so that we can be in that best space for ourselves. Next, why do people go to therapy, and how do I know if it's right for me? People have many different motivations for coming to psychotherapy, counseling, or just talk therapy, as many call it. Some may be going through a major life transition like unemployment, divorce, a new job, or relocation. Or they're just not handling stressful circumstances as comfortably. Some people need assistance managing a range of other issues such as low self-esteem, depression, anxiety, addictions, relationship problems, spiritual conflicts, and creative blocks. Therapy can help provide some much needed encouragement and help with skills to get them through these periods. Other people may be at a point where they're ready to learn more about themselves or want to be more effective with their goals in life. In short, people seeking psychotherapy are ready to meet the challenges in their lives and ready to make changes in their lives. Next, what's therapy like? Because each person has different issues and goals for therapy, therapy will be different depending on the individual. In general, you can expect to discuss the current events happening in your life, your personal history relevant to your issue, and report progress or any new insights gained from the previous sessions. Depending on your specific needs, therapy can be short-term for a specific issue or longer-term to deal with more difficult patterns or your desire for more personal development. I've found that most people, as we navigate the short-term issues, we start to dive into some of those longer pieces and patterns that maybe were getting in the way. Either way, it's most common to schedule regular sessions with your therapist, usually weekly. And it's important to understand that you will get more results from therapy if you actively participate in the process. The ultimate purpose of therapy is to help you bring what you learn in session back into your life. Therefore, beyond the work you do in therapy sessions, your therapist may suggest some things that you could do outside of therapy to support your progress, such as reading a relevant book or looking at a relevant website, journaling on specific topics, noting particular behaviors or taking action on your goals. I often have clients participate in behavioral experiments, where they might go out and try something to see what that experience was like in their body and work from there. People seeking psychotherapy are ready to make positive changes in their lives. They're open to new perspectives and take responsibility for their lives. Next question I often hear, what about medication versus psychotherapy? It's well established that the long-term solution to mental and emotional challenges and struggles and the pain that they can cause cannot be solved solely by medication. Instead of just treating the symptom, therapy addresses the cause of our distress and the behavior patterns that curb our progress. We can best achieve sustainable growth and a greater sense of well-being with an integrative approach to wellness. And this is why I offer psycho-spiritual or emotional and spiritual wellness integration practices. However, working with your medical doctor can help determine what's best for you, and in some cases, a combination of medication and therapy is the right course of action. And my last question that I'll address today, does what we talk about in therapy remain confidential? Confidentiality is one of the most important components between a client and therapist. Successful therapy requires a high degree of trust with highly sensitive subject matter that's usually not discussed anywhere but the therapeutic office or virtual office. And every therapist should provide a written copy of their confidential disclosure agreement, and you can expect that what you discuss in session, will not be shared with anyone. This is called informed consent. Sometimes, however, you may want your therapist to share information or give an update to someone on your healthcare team, like your physician or your naturopath. But by law, your therapist cannot release this information without obtaining your written permission. However, state law and professional ethics require therapists to maintain confidentiality except for the following situations, which might vary by your state: suspected past or present abuse or neglect of kids, adults, elders, or if we have reason to suspect that you might be in danger of harming yourself or others. Beyond that, all of what you share will remain confidential. I hope this information can be helpful for you if you're wondering if it's time for therapy.